After incorporation of a new treatment by SMC, physicians need to have enough scientific information to know when and in which patients to use them. But the dissemination of this information is often done by the manufacturer, causing commercial interests to interfere in the real-world results. Today, the entry for users, both in the SUS and in the NHS, is the primary care. In the United Kingdom, the general practitioner, GP, which is the equivalent of the family physician in Brazil, each neighborhood has a GP responsible for providing health care to patients in their region. At times, prescriptions containing interacting drugs that produce adverse reactions are prescribed in excess or do not follow the best scientific evidence, which directly affects patients and their quality of life. To try to minimize these failures and improve the health of the population, at the initiative of the NHS, a pioneering project was implemented in Glasgow, the Prescribing Service, a service of support to the prescribers. With it, GPs have the help of pharmacists in choosing the best treatments and medicines for patients. This pioneering initiative is only paralleled by activities developed by Australia's National Prescribing Service.
Prescribing support services are really part of the National Health Service, the NHS. And to undertake our job, we need to have the most up-to-date evidence and how it's actually applied in practice. Now, the SMC, as in the Scottish Medicines Consortium, provide advice on new medicines, and then we use their information to support prescribers in how they should prescribe. The clinicians within the acute services, when I mean acute clinicians, I mean within the hospital services, they provide recommendations to GP colleagues, which is part of where prescribing advice of our service actually is provided.
But what we're mainly doing is we're providing those reports to be used by the pharmacists who work more locally and work with the GP practices in groups of GP practices. So there's lead pharmacists above, so there's me and then there's lead pharmacists, there's 7 of them, and then below that there's the actual pharmacists who go in and out of practices. And there's teams of 30, 40 in each area, or 20, 30 in each area. So there's 7 lead pharmacists and about 100 plus pharmacists below that the reports are used. They use those reports. So we make them available and then they use them with the practice.
I'm here to assist the pharmacists dispensing medication, making up prescriptions, giving patients over-the-counter advice on different medicines, different ailments.
The prescribing service contrasts sharply with the reality in Brazil, where the main source of information on the use of drugs is in the pharmaceutical industry through the representatives, the drug detailers. In order to change this reality, SECATS, the collaborating center of the SUS for Technology Assessment and Excellence in Health of UFMG, with the support of the Ministry of Health, has carried out pilot projects to evaluate the feasibility of disseminating scientific information. But how can we assess whether the treatments provided by the public health systems are actually benefiting people?